Hello, my name is Miri Kim. My presentation is about long COVID screening for early detection. This is the table contents I'm going over today. I'll cover the significance of the problem, EBP project question, review of the literature, summary of evidence, recommended best practice, policy and protocol for practice change, implementation plan, and evaluation plan. The significance. As of May 2023, around 770 million COVID-19 cases and about 7 million deaths were reported. The COVID-19 pandemic has affected millions worldwide and significantly burdened global health system for the last few years. By then, though, no one knew this would lead to another long-term health issues. Long COVID is a condition that comes after acute COVID infection with various symptoms and affects different body systems, impacting an individual's quality of life and daily functions. As you see in the picture, long COVID is a multi-systemic illness, and some reports indicates at least 65 million people are experiencing it now, and the number keeps increasing. Continue with significance. The long COVID has several different names: long COVID, long haulers, long haul COVID-19, post-acute COVID-19, PASC, or post-COVID syndrome. More than 200 symptoms are reported, and the most common ones are fatigue, cardiorespiratory, and neurological symptoms. Montani et al. Reported that the long COVID affects 10 to 20% of people who got the acute COVID infection, disregard their age or the severity of the initial symptom. Unfortunately, no specific or definitive treatments for long COVID exist, and all current treatments focus on managing the symptoms only. Therefore, the early identification of long COVID can help people get timely interventions, improve patient outcomes, and ultimately reduce the burdens of the healthcare system we are now experiencing. Implementing a screening tool for long COVID seems an adequate solution for early detection. And from there, the EBP question was created. So my EBP project question is: in individuals with a history of acute COVID infection in healthcare settings in Southern California primary care settings, how does the implementation of a long COVID screening tool affects the quality of life by facilitating early detection of long COVID symptoms and the receipt of adequate interventions for managing this chronic condition over 6 months compared to not using a screening tool. For the review of the literature, I chose the database PubMed, EBSCO, Academic Search Elite, and CINAHL. And the key terms I used were long COVID overview, long COVID and barriers, long COVID treatment, post-COVID impact, long COVID diagnosis, and long COVID screening. Summary of evidence. The terms and definitions for long COVID continue to evolve as knowledge of associated symptoms and conditions grows. As mentioned previously, over 200 symptoms are reported, including fatigue, difficulty breathing, brain fog, insomnia, joint pain, and cardiac issues. It affects 10 to 20% of those infected with COVID-19, regardless of their age, baseline health status, or initial symptom severities. Some other study done a systemic review and found that approximately 1/3 of individuals experienced persistent fatigue, and over a fifth exhibited cognitive impairment lasting 12 weeks or more after COVID-19 diagnosis. Continuing with the summary of the evidence, studies insist early detection as a key for long COVID because the symptoms can last for months and years, and it can be potentially life-threatening, but there's no available definitive COVID treatment. For this reason, CDC also suggested implementation a standardized screening tool for promptly identifying long COVID cases. Another study proposed multidisciplinary care pathways as an essential part of caring patients with diverse range of symptoms to improve the patient outcomes. Those proactive approaches can help detecting and managing ongoing long COVID health impacts effectively. Also, some study notes the importance of health awareness campaigns targeting vulnerable communities such as population with low socioeconomic status or immigrants with language barriers. Compias et al. Conducted a retrospective cohort study. They found that COVID-19 diagnosis increased healthcare utilization and costs over 6 months post-diagnosis, indicating a prolonged burden on the United States healthcare system. Brill reported early diagnosis of long COVID in the U.S. could lead to significant cost savings of $26 billion annually. Treatment costs for early diagnosed patients are 2 to 4 times lower compared to late-stage cases, reducing healthcare burdens and costs. This approach can optimize resources and efficiently manage population needs. Recommended best practice. By putting it all together, I came up with the following 3 solutions. The first solution is developing and implementing the long COVID screening tool. Healthcare facilities should adopt a standardized long COVID screening tool for symptom detection and monitoring post-COVID-19 infection. It aims to identify potential long COVID patients early for timely intervention and research purposes. The second is setting up a multidisciplinary care pathway. Implementing a multidisciplinary care pathway for long COVID patients can improve the coordination and effectiveness of treatment. This pathway should involve various specialties to address the diverse range of symptoms experienced by long COVID patients. Lastly, develop public health awareness campaign to educate the general population, especially in vulnerable communities, about long COVID symptoms, risk factors, and the importance of seeking medical attention for persistent health issues after COVID-19 infection. This can promote early detection, reduce stigma, and encourage individuals to seek appropriate medical care. Policy and protocol for practice change. Out of the 3 recommended solutions, I picked the screening tool implementation for the policy and protocol for practice change. This will start with a pilot program of long COVID screening tools in one healthcare facility for individuals with a COVID-19 history. I also combined establishing the multidisciplinary care pathway as a protocol for a seamless patient treatment. After success in one facility, the screening protocol can scale to other facilities, including vulnerable communities. Through specialized clinics and financial support, this population will have equitable access to care. So this chart shows the details of the implementation plan for the long COVID screening tool that includes who gets involved, how it will get implemented, and how long it will take. So first, form a project team that comprising key stakeholders to oversee the implementation process. Then the team can conduct a needs assessment to understand the facility's requirements and challenges. After that, they can select a suitable long COVID screening tool that aligns with the facility's needs and capability. And they can also provide the comprehensive training to healthcare staffs to ensure proficiency in using the screening tool. Integrating the screening tool into the facility's EHR system is also important for seamless data management. Then we can pilot the screening tool in a selected unit to assess its effectiveness and make necessary adjustment. Once the pilot program is successfully done, then we can scale up the implementation of the screening tool across the relevant departments in the healthcare facilities or other facilities. Ongoing monitor and evaluation of the tool's performance is also important to measure its impact and identify areas for improvement. After that, launch a public awareness campaign to inform patients about the long COVID screening initiative. It is important to implement ongoing training sessions and quality improvement initiative to enhance screening accuracy and efficiency. This whole entire process will estimated to take about 4 to 6 months. That requires collaboration among stakeholders, allocation of resources, and continuous evaluation for successful implementation. After the implementation plan, this shows more details on how the screening will proceed. This implementation followed other researchers' design that involves 3 consecutive visits based on the time from COVID-19 diagnosis. The first visit includes patient history, examination, and complementary tests to investigate underlying causes. At week 8, which is visit 2, results of the first week are evaluated and diagnostic algorithms are applied to identify potential causes. At week 12, the visit 3 reassesses symptoms and causes using corresponding algorithms. Patient education on long COVID symptoms will be provided after each sessions of visits. The plan involves a year-long evaluation of individuals with COVID history. It involves a comparative study where retrospective data from 2 groups will be analyzed by comparing pre- and post-assessments. One group receives intervention and support services for long COVID, while the other does not. Detailed patient survey data on quality of life, health, and socioeconomic status will be collected to assess the effectiveness of the interventions and support services. The project team will collect data and provide feedback to healthcare providers through meetings and reports, enabling the early detection and intervention for long COVID. Although it was a hypothetical plan, as a limitation of this plan, further study on the ethical implementation of this project regarding the comparison group who doesn't get received interventions may be required for a more applicable and realistic intervention. These are the references I used. The end. Thank you.